Welcome to Part 3 of the 2025 Medicare Basics class. This is our recorded series presented by the State Health Insurance Program Medicare Counseling. Medicare Counseling at bouldercounty.gov is how you can email us. You can also leave us a message at 303-441-1546. Please be sure to include your email if you leave a message. In this part, we're going to be covering Medicare Advantage plans, Medicaid, and then end with a little bit about fraud. Just a review of what we're going to be covering in Part 3. Part C, Medicare Advantage plans, Medicaid, and the Medicare Savings Program, fraud, and a little bit about how to prevent it. If you want to know more about Medicare enrollment, you would go to Part 1 of the series. Part 2 is in which we cover all of original Medicare. In Part 2, we talked about original Medicare. So we were kind of over here on this left-hand side of the chart. Now we're going to look at a completely different way to review or to receive your Medicare coverage, and that's going to be through a Medicare Advantage plan, which is also called Part C plans. In a Medicare Advantage plan, you also enroll in Medicare Part A and B first through Social Security, and then the Advantage plans, they're kind of an all-in-one plan. They include your drug coverage, they may have some extra benefits, and the cost may be a little bit lower if you have a Medicare Advantage plan. Part C Medicare Advantage plans are provided by private insurance companies who contract with the federal government to provide your Medicare services to you. So these plans, they have to provide all the services that are provided by Medicare, but then the plan's going to determine the cost. They will include your Part A inpatient hospital benefit, your Part B medical, and most of them include Part D prescription drug coverage. When you enroll in a Medicare Advantage plan, you're choosing a company, and you have to live in the plan service area. So if you're looking at Boulder County plans, you're living in Boulder County, and it's going to cover Boulder County and the Denver region, so it'll go a little bit south of Boulder. You have to be enrolled in Part A and B in order to enroll into a Part C plan. And most of these plans, they require that you stay within the network of their plan. So there's different variations of Medicare Advantage plans. The most common is HMO, HMO POS, and PPO plan. Special needs plans, those are for people that have both Medicare and Medicaid or a chronic condition that qualifies them for that plan. All these plans have a maximum out-of-pocket limit. Medicare sets the top amount that they can charge for in-network services each year. This year, the most or the maximum is $9,350 for in-network services. The plan has to cover all the services that are covered by Medicare, but each plan is going to determine the costs as you access those services. So we do have a Medicare Advantage plan handout that we can mail to you. It's also available on our website if you want to take a look at it. There are many, many choices in Medicare Advantage plans. We are happy to help you review these plans. You want to make sure that your doctors are in the network. The hospitals or facilities that you're going to go to are going to be in the network of the plan that you're choosing. And you probably don't want to ask the doctor. You'll ask the billing office or whoever's working at their front desk. And when you ask, don't say, do you take Medicare? You're going to say, do you take the Humana Gold Plus Medicare Advantage plan? Or do you take AARP Medicare Advantage Extras? Be specific when you're checking to see who's in the network and what they cover. These are all the Medicare Advantage plans that are available in Boulder County this year. There are 46. It's crazy. There are a lot of plans to choose from. So you really need to look at the detail of each plan because, look at this. Humana has 13 different plans. What's the difference between those 13 different plans? It could be difference in copays. It could be some doctors are in network with 5 of their plans, but not 6 of their plans. So you really want to drill down and look at the detail of each plan. We can help you do that because we see these plans a lot and we work with people all the time. We kind of have an idea of who's in network and who's not in network when it comes to medical groups, hospitals, and facilities. But really, you want to understand with the Medicare Advantage plan, what's the maximum out of pocket? What am I ultimately responsible for each year? And and then do they cover my medications? Are my doctors in network? Understand how your plan works and what you're going to be responsible for, and we can help you review that. What are the enrollment periods for Medicare Advantage plans? Well, you have your initial enrollment period. That's the 7-month window that surrounds your 65th birthday. You have the 3 months before your 65th birthday, the month of your birthday, and the 3 months after your birthday month. That's that whole 7-month period. You have to enroll in Parts A and B first. Once you have your Medicare number and your A and B start date, then you can choose a Medicare Advantage plan and enroll in that plan. It'll start the first day of your Medicare benefit. You also have the option to switch your Medicare Advantage plan every year during the annual enrollment period. You could start with the A's of Medicare Advantage plan and go all the way to the S's. You can make a change every year if you want. So between October 15th and December 7th, you can join, switch, or drop your Medicare Advantage plan. And when you make a change during that period of time, the coverage starts January 1. We do have a note here about 5-star Medicare Advantage plans. If a company is rated 5-star, Medicare allows them to do year-round enrollment. They're not confined to just that October 15th through December 7th time period. This year in 2025, we do not have any 5-star plans. We're really hoping that next year at least one company will have that 5-star rating. So what do Medicare Advantage plans cost? You're still going to pay your Part B premium of $185 per month. We had a gentleman in one class that we were teaching that was convinced that he didn't have to pay anything for his Medicare Advantage plan. He was going to be in a 0 premium plan and he wasn't going to have to pay anything, no Part B premium. I am here to tell you that you always have to pay your Part B premium of $185 a month, even if you enroll into a Medicare Advantage plan that has a 0 premium. You are still going to pay the Part B premium. So the Advantage plans may have an additional premium on top of your 185. There's a wide range in the 46 plans that are an option for you to join, but the premiums are anywhere from 0 all the way up to $170.40 this year. What's the difference between those plans? If you pay a premium, you may have a lower maximum out of pocket. But there are some great 0 premium plans to be a member of with fairly low maximum out of pockets. When you're in a Medicare Advantage plan, you're still going to pay the deductibles, the co-insurance, and the co-payments, and those vary from plan to plan. This is why you need to do your research and really understand what are you responsible for in the plan that you're enrolling. Is a specialist a $20 copay? Is it a $40 copay? Most of these plans, your primary physician is a 0 copay, and then if you're going to see a specialist, you would have a small copayment. If you go to the emergency room, you're going to have a copayment that you're responsible for paying. Every time you make a copayment for Part A or B benefit, that is going to go to reduce your overall maximum out-of-pocket limit on that plan. And those can be anywhere from, the maximum out-of-pocket limit can be anywhere from $2,900 in a year all the way up to that $9,300 in a year for in-network services. So we can, go through these with you in detail so that you understand what they're going to cover, how you can access the services, who's in network, are your prescription drugs covered under the plan, and what are you responsible for ultimately. These plans also have star ratings, and the star ratings are based on the conditions listed there. A lot of it has to do with the plan performance and the member experience and their customer service, and whether or not they offer stay healthy programs, and do they manage the chronic conditions well. So there's all of these things go into the ratings of the plan, and we'll list on our Medicare Advantage plan handout, we have a column that lists the star rating for each plan. Most of the Medicare Advantage plans have what are called value-added incentives. These are the extra benefits that you see advertised on TV all the time. They're what people are talking about, that they get to do all of these things at no cost. Almost all of them include a gym membership. They're called different things: Silver Sneakers, Renew Active, Silver and Fit. But that can be worth $400 to $600 a year if you're having a free gym membership. A lot of them have what are called OTC cards. Those are over-the-counter cards that allows you to purchase product either online and have it shipped to your house, or maybe go to Walgreens, buy Band-Aids, Tylenol, Advil. They give you usually a quarterly amount that you can spend, and that amount does not carry over if you don't use it. So it's kind of a use it or lose it each quarter. A lot of people really like that benefit. Some plans have transportation, mostly if you have both Medicare and Medicaid benefits. These plans offer dental, vision, and hearing. Those benefits can be limited. Just depends on the plan and who's in network with their plan. But if there is a dental benefit, you want to make sure that you're using an in-network dentist and you're getting your services pre-approved. Vision usually works pretty well, covers a vision check and hardware, and it'll vary from plan to plan. One plan may give you $100 towards your vision services, another may give you $300 towards your vision services. So this is another reason why you really want to look at the details of the plan and understand what they cover when it comes to the extra benefits. Don't join a plan for the extra benefits. Make sure that you're joining that plan because it covers your medical coverage first, and then take a look at the extra benefits. If you have a Medicare Advantage plan, you're still going to have deductibles and copayments for services, and you cannot purchase a Medigap to pay those fees. Mostly you have to stay in network with these plans. So you're choosing a way to receive your Medicare coverage. You're either going to stay with original Medicare, or you're going to enroll into a Medicare Advantage plan in which you're going to receive all your services through that plan. We like to tell people to shop these plans carefully. Make sure you understand, are your providers in the network? Do they accept the plan that you want? Do you understand what you're going to have to be responsible for, what your co-payments are and your co-insurance costs are? Understand how the plan works. What's the maximum out-of-pocket? I think when you're looking at Medicare Advantage plans, you really have to pay attention to, are my doctors in the network, and what's my maximum out-of-pocket? So if everything in my world turns upside down, I understand what I'm responsible for. So in part 2, we had this same slide on moving from original Medicare to a Medicare Advantage plan. Now we're going to take a look at it from a different viewpoint. How easy is it to move from a Medicare Advantage plan back to original Medicare with a Medigap in the future? Well, this can be a little bit more difficult. The reason being that if you're not in a guarantee issue period, the Medigap company, they can and will provide you with a medical questionnaire, and depending on your answers, they can deny you coverage or charge you more. So you can move from a Medicare Advantage plan back to original Medicare during the annual enrollment period, which is October 15th to December 7th, for a January 1 start, and the way to do that would be to enroll into a standalone prescription drug plan. That would pull you out of the Medicare Advantage plan. Come January 1, you would have A, B, and a Part D plan. But keep in mind that you're going to be subject to medical underwriting for the Medigap plan, and you have the possibility of being denied that coverage based on your answers to the questionnaire. So if you're thinking about doing this, moving from Advantage back to Original, I would say start exploring whether or not you'll pass that medical underwriting probably sometime in September. And feel free to call us with questions. We can talk to you about this. Now, we can't leave you without talking about programs for people with limited income and resources. I'm sure there are a lot of people that have been listening to this three-part series and are completely freaked out by the costs. So there are programs that can help you cover the Part B premium of Medicare and possibly the copays and the coinsurance costs. This is Medicaid and the Medicare Savings Program. Medicaid is a federal state health insurance program. It's for people that have limited income and resources, some people with disabilities, and if you're eligible, it can pick up your health care costs and your prescription drug coverage costs under the age of 65. You would have Medicaid. Eligibility is determined by Human Services. There are offices in Longmont, Lafayette, and Boulder. You can also apply online. Website is there below. The Medicare Savings Program is for anybody that has Medicare. It can help pay the Part B premiums, and it may also pay the deductibles and the coinsurance costs depending on your income. We do have an eligibility sheet that's available on our website. Take a look at that, and you can self-screen yourself. We can also help you screen to see whether or not you're eligible for the Medicare Savings Program. We're happy to do that. We don't do eligibility, but we can tell you based on your income and your resources whether or not you might be eligible and should apply. Extra Help is a Social Security program that helps cover the premium and lower the copays for prescription drug plans. There's a monthly income and resource limit. To qualify for this program, you'll see what it is there for an individual and a couple. We are happy to help you complete these applications. We do them all the time. It takes about 10 minutes to do online. And then Social Security will send you a letter and let you know whether or not you're eligible within about 10 days of submitting that application. Enrollment period restrictions for people that have Extra Help don't apply. So if you have Extra Help, you can switch your Part D plan every month throughout the year. So that's kind of a nice added benefit. We can't leave you without talking a little bit about fraud because it's such a rampant problem with Medicare. This word cloud kind of represents some of the things that happen as you turn 65. You're going to start getting piles of mail. You're going to see advertisements on television, mostly advertising extra benefits and things that you might be eligible for. If you call one of those numbers that you see on TV, they're selling your information to an aggregating company who is going to sell it to every sales agent in the country, and your phone will be ringing off the hook. Know that you shouldn't say yes to questions when you receive calls from sales agents. If they say to you, do you want extra benefits? And you say yes, they record you saying yes. And if they also get your information, they may switch you into a plan that might not be best for you. So be suspicious. If somebody calls saying they're from your doctor's office wanting to confirm your information, hang up. Just hang up. If you want, you can then call your doctor's office and say, hey, did somebody call me because they needed my information? Verify. Trust but verify, I guess is what we say. And Medicare will not call you. Social Security will not call you. Just be aware that unless you've initiated the call, you shouldn't be giving out any information. If a caller is making you feel fearful or requesting money or pushing you to do something, that's the time to just hang up. Once you have Medicare, you will receive what are called Medicare summary notices, or if you're in an Advantage plan, you'll receive an explanation of benefits. On that statement is going to show the information on services you've received, doctors and services. Check through that statement and make sure that everything looks okay. If there's something on there, for instance, we had a woman who received her Medicare summary notice and it showed that she was billed for a prostate exam. She called her doctor's office. That was just a coding error by the billing office. They corrected that very quickly. So if it's something like that that's just a coding error, try your doctor's office first and they'll recode it properly and rebill it. If you think you've been a victim of fraud or you think you've given out your Medicare number or some information that you shouldn't have, please do give us a call because we are also senior Medicare Patrol certified counselors in the prevention of fraud. So we can collect that information and pass it on to the state office who will then, if they have enough information, pass it on to the Office of the Inspector General and try to go after them. Don't give out your Medicare number. Our tagline here is it's not rude to be shrewd. We've all been taught to be polite, so a lot of times when people call or they send information, we're trying to be polite. Just don't worry about hanging up or not giving somebody information. And always verify the source. So if you're getting a call that person back directly. Call your doctor's office directly. Call the supplier directly and ask if there's something they need rather than giving it out to a random person that has called and said they're calling from Medicare. If you have any questions about this, please don't hesitate to give us a call or to call 1-800-MEDICARE. We do have appointments available every week, so we're happy to talk to you. We've got lots of counselors that are standing by on the ready. Everybody is state health insurance program certified to counsel you in Medicare. The bulk of our appointments are Tuesday, Wednesday, Thursday, and we do them by phone or Zoom or in person. If you want an in-person appointment, the locations are in Lafayette, Longmont, and Louisville. So it just depends on the day and the time. But if you'd like to schedule an appointment, just call us at 303-441-1546. Please do include your email address so we can try to avoid playing phone tag and get you scheduled as quickly as possible. You can also send us an email at medicarecounseling@bouldercounty.gov. Lastly, we are a grant-funded program, so we really appreciate it if you could complete this survey. All you'll need to do is get the camera on your phone and scan this QR code. There are about 7 to 8 questions, I think, on the survey. The survey goes straight to the Administration for Community Living. We don't even see it. If it asks for an instructor, just put Boulder County. And we're completely grant funded, so we really appreciate you doing this survey for us. It does make a difference. It shows that we are completing the work that we've been chartered with. Appreciate you listening to our 3-part series, and we look forward to hearing from you. And on this slide, just one last time, is our information for contact. We are the only SHIP counseling program in Boulder County. So We'll provide you with unbiased information, education, and facts and help you navigate the process. Or if you're having any issues with your current Medicare benefits, just give us a call. Thanks.